Alrighty, perfect. So just like I said, now we're going to discuss flossing, and flossing is going to be one of these big steps that helps us stop the progression of that periodontal disease that you have going on, okay? Alrighty, so looking at these pictures, do you know what the purpose of proper flossing is?
To get in between the teeth?
Yes, that's spot on. So the purpose of flossing is to help remove, do you know how you get that plaque, that bacteria on your teeth? So when you're eating, that bacteria gets in between your teeth as well. So the floss is going to help us get that bacteria and food debris out from in between our teeth, okay? Do you know what types of floss there are that you could use?
I've definitely seen this before, and the string.
And the string? Okay, so just so we don't go too much into detail, don't get any confusion going on, what I'm going to recommend is just the regular string floss. You have some at home?
Yes.
Yes, so you can either use wax floss or unwaxed floss. I would recommend wax floss just because it's a little more, well, not slimy, but just a little more smooth to get into those little grooves and everything. Okay, alrighty. Now, I'm going to go ahead and have you show me how you're flossing at home, and I'm just going to go ahead and see if there's any tips that I can give you to help that flossing.
So I kind of just like get it in there.
Okay, so we're popping it in.
Up and down. And then get it in there.
Just up and down, in and out.
Yeah.
Okay, alrighty. So I'm gonna go ahead and show you some tips, but I also want to just let you know, when we're flossing, the one thing we do not want to do is we don't want to hear that popping sound.
Okay.
Because when we're hearing that popping sound, that means that you can hurt your gingiva, and your gingiva is your gum. It's just a fancy word of saying it, and we don't want to do that. Has there been some times where you're flossing and you feel pain in your gums? Probably because you're going a little too hard. So the new way that I want to show you is you can wrap the floss in between on your middle fingers, and you'll use your index fingers, and you're gonna seesaw your way in, and you're gonna hug the tooth to get the bacteria from both sides, and then slowly seesaw your way out to get that bacteria. Because if we just go in and out, we're just sticking the food right back in and sticking the floss right back out. Okay, alrighty, can I have you demonstrate that for me? The way I like
so
to
you wrapped it around your middle fingers?
Yes, your middle fingers. Perfect. And I like to say seesaw your way in, C shape, hug the tooth, C shape, hug the tooth, and just wiggle back out. Perfect. Do you feel that difference? You see how it's going a little softer?
It's more time consuming. It's not just like...
Yes, it is a little more time consuming, but it's definitely going to help get all that bacteria out of there and all that food debris. Okay. Alrighty. How often should you floss, and why? Do you happen to know how often and why?
Well, I only floss occasionally, like whenever I feel food stuck in between.
Okay.
More so when I floss.
And why do you think you should floss?
Well, I'm assuming to get that food out of between.
Yes, that's right. So as for how often you should floss, you should be flossing twice a day. But since we are making new plans for us to work as a team to help better your home care, we're going to just try and stick to flossing once a day, and then we'll improve from there. So do you think that's something that you can obtain, flossing once a day, flossing daily?
I think
that's
so.
Perfect. Alrighty. Okay. Alright, so now that we've discussed flossing, these are some steps that are going to help halt the progression of periodontal disease. And now I'll just re-say our goals for today, which we've checked off. Understand what periodontitis is and the cause. What's periodontitis, if you don't mind me asking one more time?
Periodontitis is a severe gum disease that will cause recession in the gum.
Bone loss.
And bone loss. Main word, bone loss.
Main word, bone loss. Okay, alrighty. And so then by the next visit, we want to reduce by 20% our bleeding score, which you're on the borderline. You're right there. Your bleeding score decreased 17%. So you're so close. Just a little more brushing and adding that new flossing technique, you'll get that 20% next time. I'm confident in it. And then demonstrating proper flossing and start flossing once a day, which you said you can do, correct?
Yes,
Alright, perfect. And so right now we're just going to go over next visit's long-term goals and short-term goals. Next visit, we'll have your caries lesions restored by 4/30/22. Short-term goal is to understand the cause of caries and the relationship by the diet. The patient, we would make you an appointment with a dentist to restore those caries lesions, and then we would also have you start using a daily fluoride rinse. Okay, that's just next visit. We don't have to worry about it now. Alrighty, so throughout today's visit, did you have any questions or concerns?
I don't think so. No, ma'am.
And you think everything's obtainable?
Yes, I'm excited to go home and practice
proper.
flossing properly.
Yes, I'm so excited that you're excited. Okay, well, I just want to go ahead and reiterate that we are a team, and I'm excited that we checked off these boxes, and I know next visit we'll check off some more. It was really nice seeing you, and if you have any questions, feel free to just come back in.
Thank you.
You're welcome. Bye.
Bye.